Did you know that Xanax isn't just for stress? It's actually one of the most prescribed anti-anxiety medications worldwide. Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Today we're talking about Xanax, a medication many people have heard of, but few fully understand. Maybe you or someone you know takes it for anxiety or panic attacks. In this video, we'll cover what Xanax is used for, how it works, its common side effects, and important precautions to know before taking it. Xanax, also known by its generic name Alprazolam, belongs to a class of medicines called benzodiazepines. These drugs work by slowing down activity in your brain and nervous system, helping you feel calmer and more relaxed. According to the U.S. Food and Drug Administration, Xanax is approved for the treatment of generalized anxiety disorder and panic disorder, conditions that can cause overwhelming worry or sudden feelings of intense fear. It's important to remember that Xanax doesn't cure anxiety, it helps manage symptoms. Think of it like a short-term aid that helps restore balance while you and your healthcare provider work on the root causes through therapy, lifestyle changes, or other treatments. Here's how it works. Xanax boosts the effect of a natural brain chemical called GABA, which stands for gamma-aminobutyric acid. GABA acts like a brake pedal for your nervous system. It slows down signals that make you feel anxious or panicky. By enhancing GABA's calming effect, Xanax helps reduce feelings of tension, restlessness, and rapid heartbeat. Like all medications, Xanax has possible side effects. According to Medline Plus, the most common ones include drowsiness, lightheadedness, and feeling tired or unsteady. Some people may also notice changes in memory or coordination. These effects can make driving or operating machinery unsafe until you know how the medication affects you. It's also important to know that alcohol and Xanax do not mix. Combining the two can dangerously slow breathing or cause severe drowsiness. The Centers for Disease Control and Prevention warns that mixing Xanax with alcohol or opioids greatly increases the risk of overdose. One of the most important things to understand about Xanax is that it can cause dependence, meaning your body can get used to it, and you might feel withdrawal symptoms if you stop suddenly. This is why it should only be taken exactly as prescribed by your healthcare provider. Never share it with others, even if they have similar symptoms. If you've been using Xanax for a long time, your doctor may slowly reduce your dose to prevent withdrawal symptoms like anxiety, shaking, or trouble sleeping. Stopping suddenly can be unsafe. Also, Xanax may not be the best choice for everyone. Tell your doctor if you have liver or kidney problems, sleep apnea, or a history of substance misuse. Older adults tend to be more sensitive to its effects, especially drowsiness and balance problems, which could increase the risk of falls. While short-term use under medical supervision can be safe, long-term use of Xanax should be reviewed regularly by your doctor. Some people benefit more from non-medication treatments like cognitive behavioral therapy or stress management techniques, which can help manage anxiety without the risks of dependence. Always store Xanax safely, preferably locked away, to prevent accidental use by children or pets. So to recap, Xanax is a fast-acting medication that helps relieve anxiety and panic symptoms by calming your nervous system. But it must be used carefully and under supervision because of its potential for dependence and side effects. Open and ongoing communication with your healthcare provider is key to using it safely and effectively. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.